Good morning. Good morning. Morning for some of you. Good afternoon for others. My name is Whitney Ball. I am the Associate Director of Marketing and Outreach at Mental Health America, and I'm pleased to have you join us for today's webinar, Back to Air Quotes Normal or Not, How to Help Your Family Through COVID-19 Transitions. I will be moderating today's webinar with the Brightline team. And like I said, we're so excited for you all to be joining us. A few notes before I jump in to introduce our presenters. We are recording this webinar, and the slides and the recording will be sent out to all registrants within the next week. So I know that is always a good question. There's going to be a lot of great content, so take notes, but know that we will be following up with a recording. We also do not offer CEUs for our webinars, but if you would like a certificate of attendance, we have a form for you to request one. We will post that in the chat in just a minute, and it will also be included in the follow-up email for you as well, in case you missed that link in the chat. Last but not least, we did build in some time for Q&A during this presentation, so please post your questions in the chat throughout the presentation, and we will try to get to as many as possible at the end of our conversation. Also, feel free to drop in comments. You know, we've kind of mastered the Zoom and webinar thing now that we're over a year into COVID. We want this to be really conversational and engaging. So share resources with each other, comment, and then we will be gathering those questions as well. So with all of that housekeeping, I will like to introduce today's presenters, and I'm going to start with David Grodberg. Dr. David Grodberg is a board-certified child and adolescent psychiatrist, and he is Brightline's Chief Medical Officer. And Brightline is who is co-presenting with us today on this webinar. He has over 20 years of clinical experience providing evaluation and treatment for children, adolescents, and their families across many conditions and levels of care. He is currently a faculty member of the Yale School of Medicine and formerly served as medical director of the Yale Child Study Center Outpatient Clinic. Among his contributions to the field, David developed the Autism Mental Status Exam, which is a brief and free diagnostic assessment for autism spectrum disorder used globally. Much of his work at Yale has focused on using technology to improve the way pediatric behavioral health care is delivered. We also have Dr. Alex Boving-Allen, who is a licensed clinical psychologist and Brightline's Vice President of Clinical Strategy. She has extensive experience working with children and adolescents and their families, from families coping with childhood chronic illness to those navigating the complex behavioral health needs. Alex has a private practice and was previously the Director of Psychological Services in Oncology at Wake Forest Medical Center, Brenner Children's Hospital. Lastly, we have Marina Scott joining us today. She's an accomplished pediatric occupational therapist with 19 years of experience in many settings, including both public and private schools, private clinics, early intervention, and teletherapy. She has an extensive background in early intervention, school-based services, telehealth, sensory integration, and handwriting. She has many years of experience in public speaking, teaching, and education around pediatric occupational therapy topics. So we're super excited to have some of the Brightline team with us here today. Brightline is an official associate member of Mental Health America, so we're really pleased to partner with them today and bring you all this much needed content as we continue to navigate the challenges of COVID. I am going to now turn it over to Dr. Grodberg, Marina Scott, and oh, yes, and Dr. Boving-Allen is on with us now too, so I'm going to turn it over to the Brightline team to kick us off.
Thanks, Whitney. So you can advance the slide. Thanks. So yeah, as Whitney, thank you for the warm introduction. And as she mentioned, I'm a child adolescent psychiatrist and I'm Chief Medical Officer at Brightline. And Brightline's the first comprehensive behavioral health solution that's specifically designed to support children and teens and their families across a range of challenges. And you can move to the next slide. And I'll start and keep going. And I want to start by talking about how even before the pandemic, we've been in a behavioral health crisis in pediatrics. And we've all heard this statistic before, that about 20% of children across the United States has a diagnosable mental health condition. And there's just no easy way for parents to get care for their kids. The most common difficulty involves what we call externalizing behaviors, like oppositional defiant disorders, severe tantrums. And then comes ADHD, anxiety and depression come after that, and then autism spectrum disorder at about a 1% prevalence. And as I said, there's no easy way for parents to get care for their kids. And access is certainly a difficulty and a barrier, but there's other barriers too, like stigma and skepticism. Many parents are very worried about labeling their children and giving them diagnoses. So there was clearly a problem that we were all addressing. And then the pandemic set upon us. So next slide, please. So over the past year, or year and a half, our clinical team, Alex and Marina and others, we've been really focused on trying to help families. And what we found is that parents have been tasked with developing highly structured learning environments at home without the training that teachers have, without the resources that schools have. And it's proved to be incredibly stressful over the past year. And this, while there's typically other children in the house, while parents themselves are trying to learn or work remotely, while they're trying to worry and protect their family's health or take care of family members who might have fallen ill. So it's been a time of adversity, and when there's adversity, there's more anxiety in children, more depression, more disruptive behaviors. Alex, I thought so curious to know what you think about that.
Thank you, Dr. Grodberg. So, one of the things that's been so tough that I think families all intimately are aware of is that this has been a combination of intense exacerbation of stress for parents, for kids, for systems, but also a reduction in terms of what's available to families in the community for supports offered to kids. So we're seeing this increase in stress, an increase in expression of all the things that David was just sharing with emotional or behavioral challenges, and a decrease in support that's offered to families and parents to navigate this.
We've heard so much about families coming to our clinical services who are parents concerned about their child's anxiety and also their disruptive behaviors. Another area that we've heard there's so much about their parents is our children needs for executive functioning and organizational skills. And that's something that Marina will talk about later on in the talk. But Marina, I'm curious if you had any initial thoughts about your experiences over the past year.
Sure. Well, I was going to say, I think, especially in the areas of executive functioning with organization and time management things, I think that's always something that kids have worked on. I think it's been much harder in the pandemic. And I think it's been much harder when you're trying to organize yourself and manage your time with your entire family right there in the same room with you. So I think it's, we're used to our routines and we're used to how things work. And when that was upended so quickly, I think to be able to pivot to a new way of doing things and starting a new way of organization and a new way of managing your time is very difficult for adults, let alone kids. So.
Yeah. Thanks. So next slide. So before we move on and start talking about anxiety and also about disruptive behaviors and organizational skills training, and if you can advance the next slide, I'd be very happy. Thank you. I just want to briefly say that there is a coming wave of difficulties that we're all sort of bracing ourselves for, and it's different. I'm old enough to have been in practice when 9/11 happened, and one of the ways that children were able to recover and reintegrate into their daily routines was because social networks were so strong, school supports support in the community, support within and between families was just stronger than ever. And that's really what's helped propel us all forward and allowed children to have that security to then pick up the pieces and continue their development. All those support systems have been degraded. And this is sort of uncharted territory for us. So we're really bracing ourselves as pediatric mental health specialists to be there for parents and to help give parents agency, as well as parents, employers and health plans, to really understand how we can address this coming wave.
That's such a great point, David. And one of the things that makes this different is that the pandemic and the stressors associated with the pandemic are absolutely a trauma. It meets all the criteria for being a trauma for kids and for families, but it's not a unitary, discrete event, which would be comparable even to something like 9/11. It's not one thing that happened that everyone can point to. It's a slow, progressive trauma over time, but that we will absolutely be feeling the impact of, but also have real opportunity to support kids and families and build resilience in the moment too.
All right, so move to the next slide. So Alex, take it away.
Yeah, so when we think about stress and anxiety, you know, when you live with people, especially if those people are your children, it impacts the whole family system. So we know that kids aren't the only folks having a hard time right now, that as parents and caregivers, that we're all feeling it too. I'm a mom of kids, and I know when they're stressed, I'm stressed. When I'm stressed, they're stressed. And that's just absolutely true for family systems. And it's very common for parents to assume that especially their young kids, may not be picking up on their stress or in the stress in the community at large. There has been so much happening this year that's not just pandemic related, that has been stressful for kids to be part of or to observe. But the reality is that kids pick up on their parents' stress just like a barometer. They're primed to be able to identify when their caregivers are stressed, because it makes things more tenuous for them as kids. So there are things that can be done in those situations. So speaking to your kids about what's going on, being reassuring but also real, and talking with them at a developmentally appropriate level, but sharing what's going on, and also not having unfettered huge emotion in front of them, but having it be somewhat controlled. Also just explaining how you feel. I know, Marina and David and I have chatted about this over the past year as we've all taken care of kids and families who are coping with this.
And I will say too, I think that there's just, what I've noticed too is there's no escape from it. So, right, if you're a mom or a dad or whatever, you have, if you were stressed about something, your kids used to be at school, so maybe they didn't see every bit of your stress because you had a break from each other. But now, being all in the same place and there's nowhere to go, I think that that's been much harder for kids just to see their parents stressed without it, and there's really no break. So there's no break from seeing that, whether it be your child or whether it be the parent. So
yeah, that's such a great point. And we know that when you as caregivers and parents are feeling your most stressed and have the fewest resources, tends to be when kids' behavior tanks, because that's their typical stress response. So it can just make the whole family system feel pretty challenged.
So next slide, please.
And we know that for young kids, that they're more vulnerable right now, just as well as older kids, that loss of normalcy and predictability, this is when I wake up, this is when I go to school, this is where my parent picks me up, all of that has been just lost during the pandemic. And even now, with kids starting to, in some districts reintegrate back into schools, that's a whole new thing. So kids have lost family members, kids have been exposed to significant health issues via family members, many of them, and all of that is incredibly unsettling for kids. And what do we know when young kids especially tend to have lack of structure is when we start to see tantrums go up, behavioral expressions that are disruptive, and emotional, more emotional challenges like anxiety.
Alex, as you speak, I'm thinking about something that I've just been working with some parents just a couple days ago on. And now that so many classrooms are in person and there's actually some after school activities or social events, I'm realizing that not every child can reintegrate at the same pace or in the same way. And there's no way to predict this. So some kids are just racing forward and creating groups and activities, but other kids who just don't know how to navigate it yet, they're feeling excluded. And that's the theme I'm hearing over and over again, both from patients, but also from parents of some of my kids' friends. So it almost feels like we need to relearn how to integrate group building skills, checking in with how people are feeling with children at the beginning of group sessions. I don't know, Marina, if you've noticed anything like that.
I think that, and it's really hard with the up and down too. I mean, so there's school, there's hybrid, you have, I know around here there's Wednesdays, there's no school and it's, like a Zoom model, or I think it's not happening as much, but back in the fall or the early winter when schools were like shutting down because either staff were sick or people had been exposed. So there was really that unpredictability. So if you're already struggling, like you were saying, David, to sort of like integrate back into things, it's constantly changing. So I think that makes it hard for kids that have already been struggling with that to continue with that, because there's I think is more predictability now, but there hasn't been a lot of predictability in any of this as well.
Yeah. And along those lines of predictability, even just as a caregiver, being able to say, this is the number of hours you'll be there. This is what's going to happen today. This is who you're going to be with. For the social, like as kids start, which I think is part of what David was mentioning too, as kids start to have these even, social experiences, even though masked and even though socially distanced, that aren't as prescribed of an experience as, say, going to school. Like, let's say you're starting soccer again, and there are actual conversations that can happen with other kids. I've had kids share with me clinically, how am I going to make friends if I'm wearing a mask and they're wearing a mask? What if I don't understand what they're saying? Some kids haven't had that experience in over a year because they've been living in their home environments and joining things remotely and not having to make new social connections with these new parameters of masks and still being distanced for kids. So some things to do are also like just limiting the time initially, so it's not overstimulating for kids, and easing them back into some of this. That can be really helpful.
And quickly, one thing I found, Alex, is that which I didn't really think of, but a lot of my kids have struggled with, are you talking to me? Because with your mask on, if there's a group of people, it's hard to know. Sometimes it's hard to know what they're saying, but it's also hard to know, who are you talking to? So it was an interesting dynamic that I thought, even just in socialization, of somebody might say something to you and it might be muffled so you don't hear them and don't respond, or you're not sure that they're talking to you. And I thought that was a very interesting perspective. I had a kid that just said, he's confused about what's going on in a social situation because you can't see somebody's lips or their face or who they're speaking with.
Right, and children will be wearing masks for a while.
Mm-hmm.
Okay, well let's move on to the next slide. So, and maybe we'll keep going. So it's a lot we want to cover. So we'll talk a little bit about anxiety in particular, and because I think we think it's important for parents to be equipped to understand, if it's more than stress that your child's coping with and is turning into more clinical anxiety, it's important to understand like what the different types of anxiety are. And these boxes sort of summarize the main buckets of anxiety, where you can have fears and phobias, you can have generalized worries about things, And then often it takes the form of somatic concerns like belly aches or tummy aches, and then can get expressed in avoidant behaviors where a child just doesn't want to do something because it's making them really anxious, and that can turn into a tantrum or a disruptive behavior. So, so there's a few things that we do. In the next slide, we work with parents and we work with children. And when we work with parents, we do a lot of psychoeducation and help explain to parents that, you know, it's only human to respond to your child when they're in distress to make them feel better. And that's what we do as parents. When your child's anxious, that triggers the same exact instinct to protect your child and to make them less distressed. And the way that we do that is by making their anxiety go away. And that's called accommodating their anxiety. So that's an area that's been researched quite a bit. How do parents accommodate their children's anxiety? And you can see on this slide the top 5 ways that parents respond to children's anxiety. And the most common is when children request reassurance from their parents over and over again because of their worries. And it's really fascinating that we can see what the top 5 are, but there's many, many others. So we work with parents to help replace that response to their child's anxiety with one that's more supportive and helps move their child forward. The other thing we do is more child-centered, and it's called cognitive behavioral therapy, CBT. And Alex is going to demystify what CBT is for children in the next slide.
Yeah. So I know that CBT is a term that gets thrown out there, and we see it in media and in any literature that talks about kids and behaviors. And so really what CBT is we represent it as this triangle that our thoughts or cognitions, which is the C, impact our behaviors, which is the B, or the doing, what we do, and our feelings. So what we think influences how we feel, influences what we end up doing. And how this manifests with kids is, say a child has anxiety about going back to school, and the thought that's specific to that feeling that they're having is, I'm not going to make any friends, no one's going to talk to me. Then their feeling could be, you know, nervousness, anxiety, you know, all of those things. And their doing could be avoidance, resistance, tantruming, doing anything they can to avoid having to actually go and have that experience. So one of the ways that we work with kids is to really dial in and help them identify what is the fear, what is the thought that's happening that links in with that feeling, and are there other thoughts that are also possible, you know, truisms that the kid could think about, try, and experiment with. So an example of this could be, you know, if a child said, no one's going to talk to me, and that results in all of this, then to say, I wonder what the chances are that no one's going to talk to you. Like, how likely is that? I wonder, like, no one? And really working with them. What's another thing that could happen? Well, maybe someone could talk to me. Maybe I might sit down and choose, oh, do you know any kids in your class? And really working through with them so that really can change their emotional reaction and enable them to have a behavior that's more in line with having a productive, good experience. So we tend to use questions like, how likely is that? And then influence their coping by saying, and what would you do if it happened? How would you handle it if you sat down and no one spoke to you? What could you do? So that kids really can gain confidence in all of this as well.
Now, Alex, when you work with kids, how long does it typically take? How many weeks usually?
Yeah, it's such a great question. So obviously that's dependent upon how extensive and impactful their worry is, how long it's been going on. But, you know, we can really start to see shifts in kids even within a few sessions of doing this type of work, especially if they have a pretty, you know, identified fear or something they're trying to avoid that and with parental support. So if the parents are engaged and involved in supporting the work in the course of the week and reminding their child, helping them identify those thoughts, helping them see those feelings that come up, then the work can actually be pretty quick to see changes.
Okay, thanks. So we'll move to the next slide. And then the next one.
So the practice is just parents participating and helping their kids in the course of the week.
Right, like there's so much work that can be done outside of that clinical hour.
Yes.
That really helps improve the outcome. Okay, we'll move on, just in the interest of time, to the next slide. Now, I'm going to talk briefly about disruptive behaviors, and then Marina's going to talk about executive functioning. But I mean, tantrums and disruptive behaviors are very common to begin with, but they're even more common now. And we're hearing from parents that children, especially younger ones, are having a difficult time, and the fuse is shorter. It's harder to soothe them when they're having a tantrum. The things that used to work aren't working. Sometimes the tantrums are even becoming aggressive, which is always stressful for everyone. The next slide, is what we use to work with parents. And again, it's that psychoeducational piece to help parents understand that behaviors, and in particular children's tantrums, really serve a function of communicating something. And the four functions of tantrums are to keep doing something that you want to keep doing, to avoid something that you don't want to do, to get attention, usually when you're understimulated or bored, or to express outrage over a rather minor provocation. And we work with parents, and especially with the younger children, we do what's called parent behavior training or parent management training, which in our Brightline clinical services is about a 4 to 6 week session of sessions where we work with parents. And on the next slide, I think we have some information. We keep going. We work with parents to teach basically the positive parenting approaches. So we don't tell parents to focus on the child's negative behavior and to make it go away using punishment or other approaches, but instead to focus on the positive behaviors that they want their child to do, and to figure out how to reinforce those and to make them stick, basically. So the first thing, as an example, that we work with parents on is making sure that they understand how to use praise, which is an incredibly powerful tool to reinforce children's behaviors. And there's 3 essential ingredients to praise. So one of them is to be effusive and to say it like you really mean it, and to be very specific about the task that you're praising, that you want your child to do. And then to incorporate a nonverbal aspect like a high five or a pat on the back or a gesture. So that's just a small example of what we do. And we work with parents to figure out how to promote those positive and opposite behaviors that we want the child to do, and to have those expand and generalize and replace a lot of the negative behaviors. So I hope this gives you a slight flavor of what that is. We'll move on to the next slide. And a couple examples here are we teach parents to use really clear and specific instructions. Instead of telling when you identify what's triggering a tantrum, sometimes we'll work with parents to help them, instead of telling the child to do a specific thing, you can offer choices or agree on a stopping point if it involves changing an activity. Next slide. And I'll pause there, and hopefully we'll have time for questions at the end, but we can talk some more about disruptive behaviors. But I'm going to now yield the floor to Marina, because this is something, executive functioning, that we've heard so much about from the parents that we're meeting with.
So you can go on to the next slide. So I think the thing about executive function is it does go hand in hand with some of the things that both Alex and David have talked about. So sometimes with those disruptive behaviors, again, it's that unpredictability of the schedule, or managing time, or being together so close in everybody's space. And so a lot of the things that I have seen recently, especially with going back to in-person school, like I said earlier, is really being able to manage that daily schedule and knowing what's coming. Again, there's hybrid models. Sometimes schools are closing because of COVID outbreaks or whatnot. So just being able to manage that daily schedule, and for kids to know what's coming. There's a lot of certainty in knowing what's coming, and sometimes that can't be helped, and sometimes it can. Also being able to keep, you know, your kids engaged and motivated. I think that that's been a hard thing on Zoom all year. So, you know, back to in person and just getting them moving around and not just sitting in front of a computer screen can be really helpful for some kids. And then, you know, I think an important piece of all of this is to make sure that you are paying attention to what's important to you and your family, what's important to your child. What might be important to you for your child might be different than what's important to your child. So making sure that you're paying attention to those things, and then giving time to adjust. I think that, you know, sometimes, as David was saying earlier, I think just even like in social groups and things like that, being able to have some time to kind of get back into the swing of things. And, you know, that being said, there are kids that have really flourished on Zoom. Like it's been like a good thing for them and it's been easier and there hasn't been so many pressures and things like that. So those kids can also have anxiety in going back to in-person school. So it's not just those kids that are looking for like that social group, but those kids that have found, you know, a positive experience on Zoom. So if you want to go on to the next slide. So there are different ways to make progress in that. And I think that these were things, again, that David, both, and Alex mentioned. And that would be to keep things consistent and to use simple language. The best, again, to the best of your ability. The schedule is going to change, but as much as you can keep things the same. And I usually encourage parents to keep things the same even on the weekends, which I know is hard because we all like to sleep in. But for those kids that really have a lot of anxiety or worry, sometimes just having a 7-day-a-week consistent schedule can really do wonders for them. And I think another important thing is to make sure that your kids are a part of what you're doing. So my idea of what the ultimate schedule would be might be different from my child's. A lot of times us as adults, we tend to say, here's the schedule, here's what you need to do, go through these steps. But you know, your child might want to do their math homework before they're reading homework, or they might want to, you know, skip out of soccer this year, but play baseball. So I think you have to remember when you're sticking with a routine or even activities to make sure that your child is involved. I think sometimes too, that helps. It can help with the behaviors because again, they're part of what you're doing. It's not just something that you're handing to them and saying, now here's what you have to do. And that also helps with problem solving when there are glitches in the schedule, school gets closed down, mom has a meeting and, you know, dad's got to pick you up from school or whatever that is. When they're part of working on that, as opposed to somebody just giving it to them, I find that sometimes that can ease some of those fears. And we talked a lot about being able to acknowledge those feelings and Alex talking about the cognitive behavioral therapy. And I think that that's a really important piece of that. And one of the other biggest things I would say for progress is to get outside, even just for a second, even if you stand out on your front porch and give a good scream, take in a breath of fresh air, whatever it is, to really just make sure that you have time to be outside. It does wonders for you. It does wonders for your kids. It just can help to sort of reset those things. So we can go on to the next slide. Oh, sure, David.
I've always
David and I are both
so interesting.
Right.
So, all right, I go first. Marina, so often people combine executive functioning and organizational skills training with ADHD, but it's really a difficulty that we all have,
yes,
to one degree or another, and it's not necessarily connected with ADHD exclusively, right?
No, oh no, it's not. So you can have executive functioning difficulties with ADHD, or you can have executive functioning difficulties without ADHD. So there's just some people that are like always late. They're always late for whatever they show up for. That doesn't necessarily mean that there's an ADHD diagnosis there. So yes, those two things can be separate. And you can also be stronger in one area of executive function. You might be able to make it to your meeting on time, but you can't remember what you did with your presentation. So there are different parts of executive functioning that you can, you know, be stronger or weaker in.
And Marina, one of the things that you've shared that I have found so helpful is the paying attention to your child piece. So your child may be needing to sit for a 2-hour Zoom block, but if you're seeing lots of wiggles and just needing to move their body, having the moment to say, that's when we need to stand up and get some of the wiggles out, or giving them, you've described giving something like heavy work for them to get back centered in their bodies. I don't know if that's something you could just share. I found it so helpful.
Sure. So I think, what they say is heavy work and deep pressure activities are calming and organizing. So if you think about pushing or pulling something, rolling on the ground, but those things also can just help reset your brain. And especially when you've been sitting for a long time. And so I think, a lot of adults need that as well as kids. So to just integrate that into whatever is going on in the day, and you'll often see teachers do that. They do things like go noodle, or they're doing jumping jacks, or they're marching around their classroom. So anything like that can really help to reset the brain.
Thank you.
Sure, we can go on to the next slide. So I think, general wellness matters too. And again, I think, it's one of those things that sounds cliche, but sometimes I think we need to have a reminder about. That's getting enough sleep, drinking your water, getting some nice nutritious meals. We just sort of talked about getting outside. But a lot of these things can really just help reset your brain. And they don't have to be long or take forever. It can just be something that's quick and short. But that just, again, really resets your brain. And that can sometimes help you with some of those executive functioning skills, or even some of those behaviors that we were talking about. I think, Alex, again, talked earlier on about talking about your feelings, but that's really something I think important for our kids. We often, again, as adults, seem to think that, oh, you must be feeling a certain way, but to actually talk to your kids and have a dialogue with them about how they are actually feeling. And that can be really empowering, I think, for kids as well. So I think all of those things are really important, but can help sometimes boost some of those behavioral or even executive functioning things. Some of those tasks that might be difficult. I think it can be really, it's, a really quick way to sort of help with some of those things.
I'm so glad that you mentioned just general wellness and described both the need for nutrition and exercise and physical activity, and also there's sleep hygiene, which
Yes.
At least in my family, everyone, when it's a remote learning day, people tend to sleep much later than usual.
Yeah. Well, and I think too, Alex, you might have a thought on this, is that I think sometimes with disrupted sleep, you can also, I think that increases your anxiety and worry. I know if I haven't had like a good night of sleep, or that can, you end up being short with somebody, or your behavior might be a little bit off. So I think that there's validity to paying attention to sleep.
Absolutely. We also know that when kids aren't getting enough sleep, it ironically can make it harder to get them to sleep. So kids getting off of a regular sleep schedule eliminates adults' time in the evenings to decompress without direct observation by your children, but also can make it really hard to get into a sleep schedule if you're not consistent with your kids.
Marina, one more question, and then we'll move on, and I think we'll eventually get to open it up to questions from the audience. If when you just mentioned helping children identify how they're feeling, and would you have any quick tips for our listeners today about if they were having a play date or a group activity with a bunch of children? Are there any ways that you found that work that children and parents can use to help children identify how they're feeling?
Yeah, so I would
types of categories of feeling.
Well, I would definitely say ask open-ended questions. So, and I think if you're talking about like a social interaction or a play date, don't ask your child right in front of the child they just had a play date with, did you have fun? Because sometimes the answer might be no. And, so I think it's, asking open-ended questions. Well, what did you do? Oh, well, how did you feel about that? A lot of times, the child will say, we went to the playground, and I'm like, oh, that sounds like so much fun. So I've already kind of given the thought to the child that sounds like fun, but they might have been miserable. But, then they're starting to think, well, should I say it was fun? So I usually do a lot of like stepping back from the conversation and asking some open-ended questions. Oh, you went to the playground. Well, what'd you think about that? And then let them do the talking, but trying not to label the feeling before they've said it. And again, I think that's just typical human behavior. We tend to label things, even our feelings. If I'm feeling sad, I would assume that the person next to me would be feeling sad, but that might not necessarily be the case. So I think to just sort of take that step back and listen to what the children are saying or what your child is saying can really be helpful in sort of encouraging them to talk about their feelings.
And just to piggyback on that for 1 second, also when asking, like really listening is helpful. And we're all multitasking and doing 40 things at once. But if you ask your kid how they're doing, like making eye contact, bending down to their level if they're still smaller than you, giving space for the answer. Sometimes kids take a second to formulate their verbal response and think about how to put their feelings into words to communicate it. So just giving space for that without seeming distracted or impatient will get you a much more authentic answer than not giving space for it.
And I think that being said, to make sure you listen to the whole story. So my daughter, I love her dearly. Her stories are long, but I make sure that I listen to the entire story because there's usually something in there, sometimes closer to the end, that me as a parent would want to pick up on. But oftentimes we're, in such a hurry or rush or whatever it may be. Listen to the entire story and see what comes out.
I also think that, it's probably really stressful for parents if their child's having any kind of social anxiety right now, because we all want to get social and get back together. And I imagine it's difficult. I know it's difficult for many parents, whether, it's not clear if you should push your child to get in there or be there for your child and really, allow them to avoid a social activity. So it's something that I think we're all going to be experiencing as kids with different vulnerabilities, are moving back into the social domain. One thing that I think of from some work that was done at Yale Child Study Center in helping parents support children with anxiety, and I alluded to it earlier in the talk today, is to really let your children know that you acknowledge that they're anxious and they're worried. Like, I get it, this is hard, I know this is really scary. And then to also convey confidence that also that they're going to be able to get through this. Like, it may be hard, but you have the confidence that they can do it.
Yeah, to piggyback on that, I often will say to the students I work with, it's okay to be nervous. It's okay to be mad. I think a lot of times, especially if we have children that have behaviors, then it's sort of, you just want it to stop, right? It's okay to be mad. I'd be mad about that too. Let's see how we can, what are the next steps that we can take? But sometimes I think just that validation of feelings, yeah, I'd be angry about that. Oh gosh, I'd be really sad about that too. I think helps to relate, but also helps to make the children feel like they're not alone.
So should we move to the next slide?
Right. So this is just a moment for us to say that you and your family can get through this, that despite the hardships and that this experience really has been a trauma for many kids and families, that families can get through really hard things and come out and be functional and better than functional, healthy and fine. But there are things that we know promote kids' adjustment to hard times. And that, the concept family resilience is really about how as a family do you navigate the tough stuff? How do you come back from it? Are there opportunities for growth moving through really hard things? And yes, there are. There are opportunities for growth in navigating something really hard together as a family. So we know that there are certain pillars that will influence coming through something that's hard and coming out the other side in a place of strength. So, communicating is one, so that we've talked about a lot of this, but just having really open and supportive and attentive communication with your child. Keeping up social connections is a tricky one during the COVID pandemic. And so we've talked about that a bit, but just how helping to support your child in a way that's comfortable and safe, but still maintaining those social connections, even if there are fewer kids or family members, but having quality of social connection. David, I've loved how you've described maintaining a positive outlook before, but just just keeping a hopeful and positive orientation.
Yeah, and I think we can end with one more point that's not on a slide here, but I think it's really important that there's no such thing as a perfect parent.
Yes, that is great. So reduce the pressure if you're feeling it.
Okay, so I think we'll move on. I already described who we are and what Brightline is, but we're once again we're a company that is we're the first company that's developed comprehensive behavioral health solutions for pediatric behavioral health. So we're really thrilled to be part of this today.
Thank you all so much for all of that information. I think in our conversations between Brightline and Mental Health America, one thing we have recognized is the challenges that parents and those who work with parents are currently facing and will continue to face over the next year, maybe longer, regarding the mental health impact of COVID-19. So this information was so important to keep in mind and remind us of things we can do. So I really appreciate our panelists today. We do have a little time for Q&A, and I've already gotten some great questions in the chat that we can kick it off with. I just want to do one more housekeeping reminder that yes, we will be sending out a link with the slides so that you all can use this information with your clients, with your families, and with your, with your own children. So that will be coming. So let's jump into some Q&A if our panelists are good with that. I want to start it off by asking, we're moving into the summer months. For a lot of people, that means school is letting out. What can parents proactively do during these summer months that can help prepare their students for the transition, hopefully back into the classroom in August and September? And you've touched on a few things, but just proactively thinking ahead, wanting to prepare their kids, what are some things parents can do or think about? I'll open that up to any of you too.
I think that one of the things that helps is consistency. So you can't have consistency with school when school's not in session. So what are the aspects of school that might be a little bit more challenging when you think about your individual child that is either your kid or the child you're working with? And if it's anxiety about being with other kids, is there a structured opportunity over the summer to engage them in a group setting with other kids, even if it's just a little bit? Is there anxiety about having a routine and a schedule? Then can you implement something that is a consistent routine and schedule in your own home over the summer to get them used to a wake up and get dressed and get going? And then, also just if you're seeing anything concerning to you that is more about their emotional expression, making sure, again, if they need support from a therapist, to get them in care with a therapist to bolster those coping skills and prepare them for feeling really confident moving forward. And having good communication as a family about all of it always helps.
Yeah, and I would definitely say too that even though we talk about structure and routine, try something new. The summer is a perfect time to try something new. So if your child has always wanted to play soccer, while they're trying to get back to school might not be the greatest time, but maybe the summer is the time to try something new and see how it goes. And then talk about all those things that Alex just mentioned. Talk about those fears and worries and anxieties and how it felt and what did you like. Sometimes the groups are a little bit smaller. You can do, camp for a half day, or let your child pick something that they might be interested in where it's something new and different.
Marina, I have a question that's related to the question we're answering. If parents did want to work with their children to get them sort of used to more structure, like as the summer's ending, how far in advance of the school start date would you recommend parents, start working with their children and implementing a schedule and things like that?
I usually say at a minimum 2 weeks. Mm-hmm. I think if you have a child that has a hard time with change and transition, I would give it a month. So, that does cut the summer a little bit short, but I give them that time to adjust. I also say to parents sometimes too, even for kids, and they don't think it, like they're not overly anxious or worried, but you can tell that they are worried. I drive past the school on your way home, on your, you just zip on by so you can remember what it looks like, talk about where your classroom might be, get pictures. Sometimes those things just ease those fears that kids have.
Great tips. I love all of those. I want to shift a little bit to in the next question. Let's talk about grief. Students faced a lot of setbacks in 2020 and into 2021, missed graduations, missed presentations, big milestones. How do we help students and children cope with the loss that came with COVID? And then at the same time, deal with the anxiety that loss might come back up again in some way. They felt it before and it didn't feel good. So how can we kind of help them deal with that and move forward?
Yeah, I mean, I at first I was thinking I felt so badly for like high school seniors because they really had to let go of all of their expectations for senior year. And then I realized that ninth graders are having just as much difficulty because they had to let go of the expectations they had for going to a new school. So I think it's just become the most generalizable experience, and that's been one of loss. So many children have been robbed of all of the academic and social and cultural experiences that are typically so formative in these school age and teenage years. And I think it's absolutely accurate to think of it in the context of loss. Alex, yeah. I'm curious, because I know we've had conversations about this.
Right. As parents, the impetus can be, not always, but can be to gloss over loss, because when your child's in pain, it's really painful as a parent. So, it's a little helpful sometimes to think about kids' experiences as concentric circles almost. So really small or really young kids, their circle is their experience and their immediate family. And then as kids go to school, it starts to include peers and teachers. And then as kids get a little older, it starts to include other social dynamics. And then by the time they're teenagers, they have many layers of concentric circles. So as parents navigating loss with your child, a child who it has a small, tight circle, the loss may look small to the parents, but be very impactful to the child and the child's experience. Also, an adolescent's loss of, I've been looking forward to walking off campus for lunch with my friends, and now I don't get to. That can be huge for that adolescent in a way that parents may not relate to or think about in that way. So one strategy as a parent is just to remember not to minimize or dismiss and say, yeah, but like next year is going to be great, which is also a tendency to look forward. And so really sitting with the sadness or sitting with the loss and just saying, I'm here for you, and I know this is hard, and it's tough that you're going through it, and just being present with them while they're going through it. And then also, you spending time interjecting positive experiences where you can. But the reality is, as David was saying, it's been loss, and there's no glossing over that doesn't fix it. But being present with loss can really help increase those familial bonds and help adolescents and young kids learn strategies, because this has been a monumental loss and a cultural moment of loss, but it won't be the last loss. And so what can we learn about dealing with loss and helping our kids navigate that they can carry with them as strengths for how to cope with other things that will be hard in the future too?
Yeah, Alex, there's so many different ways that we can be there for our children, you know, as parents. And what I'm hearing you say is that we really just need to be with them and sort of do what's called reflective listening, and really just listen to them and make sure that they understand that you hear them. The other thing I think about also is that sometimes kids need a little help and prompting and guidance to reconnect in the context of loss. And that's another aspect of this, I think, where sometimes you need to really sit down and make a plan, like on paper sometimes. All right, these are the people that were in that circle, and I'm going to reach out to this person next Saturday. We're going to make a plan for that, or to really map it out for a child with, you know, real structuring and prompting, and then with the plan to fade away as kids get more.
Yep.
You know,
and if you see, you know, to David's point, if you see your child slipping, not just from being present with and upset or frustrated with what they've lost, but really slipping into more isolated behaviors, not wanting to engage with other kids, not wanting to come out of their room, or real disruptive behaviors, potentially if they're younger, usually, then that's a time to think about those proactive responses. And I love the idea of making a plan. In CBT, it's called behavioral activation, when you really help identify what are the mood boosting things for your child that can really help, and make a list, let them choose, make a plan to do it.
And then I have to also just add to that, and I feel like we could just keep talking all day long, but you know, again, it's only human to feel sad and to feel like you've lost something important. But if parents, you're worried that your child might be feeling profoundly sad or stuck or hopeless, and they don't see how they're going to get through this, then that is really a time where you might want to reach out, or you should reach out for help, whether it's the school counselor or your pediatrician, or a behavioral health specialist in your network.
Well, and David, I like your suggestion of breaking things down into manageable pieces. I think step-by-step action for some kids can be really important, because it's not just go back out there and meet up with your friends, but how do you go about doing that?
Yeah.
I'm gonna jump in and ask one final question, because we're already at time. It flies by when we have so much good information to pack in. I'm going to do a little magic here and try to combine two of our questions, because I think they touch on something similar. What can communities do to support families who aren't ready to go back to the reality and enjoy this new normal, and are kind of liking the way things are, but you know, for our schools that are on here, or our community mental health facilities that are on here, what can they do to support families who kind of like the way things are and aren't ready to jump back into the busyness and the soccer games and t-ball? And then the second piece of that kind of goes with this question is more focused on the teenager who kind of used this pandemic as a way to sink into their room, shut the door, and kind of not engage with people, who have completely disengaged and isolated themselves during the pandemic. And that's kind of become their new normal. How can we help them? So touching on either one of those, we'll make that our last question for today before I wrap things up.
I mean, I could start, and I'll start by saying that I think we as adults have the same challenge ahead of us. I think we have no clue where things are going to go as far as the workspace environments. How often are people going to go into work or do remote learning? How are we going to reconnect with acquaintances that we weren't best friends with, but we haven't really hung out with them in a year? Like, how do you do that? That seems a little weird. So I think for adults, it's going to be awkward, and for children, it's going to be really, unpredictable. We don't know how it's going to go. So I think that's the first step in knowing that we don't have answers to that. And I know I sound like a psychiatrist right now, but I think that really is the first step. And then I think the other important thing to know is that everybody has their own vulnerabilities, and some people are going to be able to jump right back into things, and then some people are going to need to take, a different course or different pace.
And I think it might be, sorry.
You go.
I think it might be easier said than done, but I think also to keep the resources open and available. I have some students who aren't comfortable going to school and I meet with them over Zoom. I have some students who are, as all they want to do is be in school. So I think making sure, and I know for us as adults, that can be hard to find that, to keep that balance, especially if that's your job and you're working, but to maybe keep some of those resources open, that now just because things are getting back to possibly normal, that we don't shut down the resources that have been opened up since COVID began.
Yeah. And I would just add a final note of, as families, also give yourself some flexibility and some grace. Absolutely. If you don't feel ready to hop into extracurriculars and going to school is a big enough thing for your family right now, then do that. No one ever suffered dire consequences from not doing soccer in fall of 2022 or 2021, right? Like, so just if there are pieces of the family dynamic that have benefited from the slowed tempo and more time at home together, then make that call and feel okay about it for your family.
I think that those are some great takeaways to end on. The grace that we can show ourselves, our children, our communities as we continue to cope with the challenges that this pandemic has brought in terms of mental health. I want to give a big thank you to our three panelists for taking the time today to share this valuable information. I know we didn't get to every question. I wish we could talk for hours about this because I know it's needed, but I will plug that, you know, if this is an area that you're still looking for support in and that you need more resources, to visit Brightline and check out all the different things that they are doing to address some of these challenges that parents are facing. Their website's listed right there on the screen, hellobrightline.com. So please give them a look, and I thank them for being an associate member of Mental Health America. I want to thank all of you for joining us this Tuesday of Mental Health Month. We kicked it off with a bang with good information, and I'm glad all of you were here. Again, we will be sending a follow-up email with the recording link that will have webinar slides too with it, and the link to request a certificate of attendance. So one more thank you to my panelists for all your great information and insight, and we hope to see you at our next webinar. Thank you, everyone. Have a great day.
Thank you so much.
Bye-bye.